This is A Silent War Within, the podcast dedicated to confronting the unseen mental health battles carried by our first responder and healthcare heroes. This show is about real stories, real struggles, and real ways to survive the storm and come out stronger on the other side. For too long, stigma has kept you silent. But this is your space to bravely break that silence, share vital insights, and build a community where your well-being truly comes first, because your service deserves unwavering support.
We are professionals when it comes to reading data on the street. We can look at a dispatch screen, analyze building constructions, or scan a patient's vital signs and know exactly how a crisis is going to play out before it even happens. We pride ourselves on tracking every single statistic that keeps us alive in the field, but for decades, there was one statistic the entire public safety machine deliberately chose to ignore. It's the number of operators who survive the shift, back the rig into the bay, and then quietly take their own lives in the dark. The system wanted us to believe those losses were isolated incidents. They wanted us to pretend that the armor doesn't have a breaking point. But our guest today refused to let the system keep lying. He stepped away from the captain's seat, put a clinical lens on the firehouse culture, and started tracking the real body count of this career. Not to shock the world, but to give us the raw data we need to fight back against the quietest killer in our ranks. Welcome back to A Silent War Within. I'm Kevin Whitsell, and today we are pulling up a chair at the kitchen table for an absolute trailblazer in the first responder mental health community. Jeff Dill is a retired fire captain with over 3 decades of fire service. Seeing mental health gaps in the culture, he went back to school, earned his master's degree, and became a licensed clinical professional counselor. And in 2010, he founded the Firefighter Behavioral Health Alliance, the only organization in the United States dedicated to tracking, validating, and analyzing firefighter and EMS suicide data. He's an international speaker, a structural behavioral consultant, and the man responsible for teaching crews how to perform an actual internal size-up on their brothers and sisters before it's too late. Jeff, you've dedicated your whole life to breaking the silence and forcing the machine to face its own reflection. Thank you for being here today, and welcome to the show.
Well, I appreciate it. It's a pretty good show right there. Let's wrap it up now.
Well, I appreciate it. I've started doing these intros, and it seems to be going well. It gives us a good kind of launching point, and really seems to, in the first couple seconds, kind of hold the listener a little bit better. Tell us a little bit about your career and what eventually made you say, I think I want to get into this mental health thing. I think I want to cross the border and come over and do something a little different.
Well, it is amazing how you're put on different paths in life and you're not even expecting that path. I started as a volunteer in the 1990, and in 95, I went career with Palatine Rural Fire Protection District, which is in the northwest suburbs of Chicago, about 15 miles from O'Hare Airport. And I moved up the ranks pretty good. I was probably a battalion chief the longest, and I was currently a battalion chief in 2005 when Hurricane Katrina hit. And Division 1 outside of Chicago sent down numerous firefighters, including a couple from our department. And when they came back, I spoke to just hundreds of firefighters, and it was all the same message. They went down there, they saw devastation, destruction, they were picking up bodies in the streets, and when it came back, they were struggling. But understanding that in 2005, we never talked about behavioral health. We didn't go to our employee assistance program counselors. Not that they weren't good people, it's just that we never let them into our world. And so it became an issue where I thought, well, what can I do to help out my brothers and sisters? That's when I went back, got my master's degree, became a licensed counselor. And actually in 2009, I founded Counseling Services for Firefighters, which we started training clinicians and chaplains across the U.S. that, hey, you want to work with us, you need to understand us. We're a little different. Not that it's wrong from our point of view, but we're a tad bit different. When in early 2010, I started receiving emails and phone calls from all over the world saying, do you do anything about firefighter suicides? Never heard of such a thing. No one ever talked about that. Started doing a little research and found out we might have a bigger issue than we realize. And so in 2010, my wife Karen and I, we founded Firefighter Behavioral Health Alliance with the purpose of educational workshops on such things as depression, PTS, addictions, relationships, suicidal ideations, and of course post-traumatic stress. But we also then started to track and confirm firefighter, EMS, and dispatcher suicides. And I'm amazed how fast 17 years have gone by. So it's been a learning, continuous learning is what it is. And I'm not an expert on this field. I don't believe anyone's an expert in this field, but we keep on learning, and hopefully we can just pass something on to your listeners here today.
Yeah, absolutely. I got to hear you speak at the Tennessee First Responders Foundation kind of mental health summit they did here in Memphis I guess it's a few months ago now.
Yeah, it was April, right? Mm-hmm.
Yeah. And one of the things that I was very taken back by is the statistics that are true and valid and kind of really, like we said, really have been studied and analyzed and proven to be the truth. And this is not just bunk statistics that you'll find all over Google. If you were to search this is real analyzed data that you've really researched. But I guess the big question when I'm sitting there in the audience and I'm listening to you talk, and you talk about becoming a therapist, what was the hurdle there when you have a first responder sitting across from you? How do you get them to trust this therapist who, to their knowledge, is just a therapist? I mean, how does that conversation go?
Well, it is very difficult, and I did have to promote myself to say, "Hey, I'm a fire medic. I've been in the fire service for umpteen years, and I know exactly where you're coming from. I feel like I've sat in that chair, wondering who am I sitting here talking to that has probably no idea. But it's even like when I went to early on in 2011, 2012, 2013, when a department would bring me in to do workshops. I'd greet people at the door and they'd say, "Oh, great. What organization are you from?" And I said, "Well, I'm a battalion chief out from the Midwest." "Oh, you're one of us." And it was just like, it's their eyes opened up. And it's the same thing with the counseling world. "Oh, you're one of us. You understand what our world's all about." And the acceptance, it was rough. When we first founded FBHA, we were getting emails from people all over the U.S. saying, "You know what, PTS, that's a military issue, Jeff. Why are you bringing it here? And suicides, you're making up the numbers, Jeff." And it's like, really? What do I have to gain by making up the numbers of our brothers and sisters'
Right.
losses?
Right.
And so it was a big hurdle to get over that, both being, "Hey, you know what? I might not be a Boston firefighter. I might not be an Oklahoma City firefighter, but I've been in the fire service in the Northwest suburbs. I know what it's like. Fires don't
Yeah.
burn
Yeah.
differently. People don't die differently."
That's right.
So I'm just bringing you, and that's what makes us different. Back in 2010, there were no organizations doing what we were doing. And that's what makes it different today. Even today, is no one can touch us with the stats. There is one organization out there that wanted to work with us, and they did mainly police. They did get into the fire, but their numbers are almost non-existent compared to ours. And so um, I tell them that not only the data, no one can touch us with the data, but 90% of our 16 workshops, we have 16 different workshops now. It amazes me when I say that, because we've learned from our brothers and sisters and family survivors. And that's what makes it different. And I don't sit here on the internet and pull things off. "Oh, that looks like a good phrase to use."
Yeah.
These
Yeah.
these are our brothers and sisters, their words that they struggle with. And so it's pretty enlightening. I was just at Oklahoma this past week, and it was the same thing. "Jeff, man, it was a military, because I track military firefighters. I was at an Air Force base, and they said, 'Oh man, we thought where someone's going to be talking about suicide and things. It'll be a long 2 hours,' but they were just so intrigued because, like I said, it comes from our brothers and sisters that are struggling out there, and they can relate to it."
Yeah, and I guess one of the other things that really strikes me about you, so how long total in the fire service have you had? You said 1995,
1990,
6?
I retired in 2015. So 1990 to 2015. Of course, I've been doing FBHA for this year, this
Mhm.
long. And for the last 5 years, I've been the behavioral health administrator for Las Vegas Fire and Rescue. So I'm working with my
Oh,
brothers and sisters
wow.
out here. So from 90
Yeah,
to 2026, that's 37 years.
yeah, and that's what I was so shocked by. You know, you come from kind of a culture in that era, like you alluded to, even when I started in 2007, like we didn't talk to anybody. We didn't talk about any of this stuff. And to see a 37-year veteran guy get up there and say that, it really takes away that stereotypical, um, you know what you signed up for, suck it up and deal with it, move on. And I think that's important because as my kids tell me, you're from the 1900s and people from the 1900s don't talk about this stuff. You know, I have a 15-year-old daughter that says, you know, Dad, I would never go to somebody in my school from the 1900s. And I wish she'd quit referring to me that way. Um, but she said, I would never go to somebody older and talk about some of the thoughts that I've had in the past or some of the things that I struggle with and some of the things that I deal with. And so seeing you on the stage, it was really a breath of fresh air to see a veteran guy talking about some of this stuff. So, where in your career did you have this aha moment to get out of that tough it out mentality that you obviously were very much raised in, and I was raised in to some extent? But I think over the last 10 years, it's definitely gotten better. But there had to be a moment for you where you're like, hey, something's got to give.
Yeah, and it's something I talk about all the time, and that's when my our first granddaughter, our oldest granddaughter, at 22 months old, came down with retinoblastoma, cancer of the eye, and had to have her eye removed. And and I didn't say anything to anyone. I thought, well, I got to be strong for it, and I can't tell anyone that this hurts me because I'm the husband, I'm the father, I'm the grandfather, I'm the battalion chief, I'm the counselor. I just founded FBHA. Well, what would people think if I showed weakness?
Right.
But
Right.
it became a reality to me, that the thought process that, hey, I'm supposed to solve this issue. I'm supposed to save her right eye,
Mhm.
and it's like I can't do that. Who in God's name do you think you are? And it was more of, you know what? Now I'm dealing
Right.
with these emotions of my own, saying, "Hey, you're not as strong as you are, and as you think you are, and you're no match for your brain and your heart. So no matter how tough you think you are when you put this uniform on, but that
Exactly
comes to
right.
that cultural brainwashing that I talked about, Kevin. That when even society is culturally brainwashed, we put this uniform on, we're supposed to act strong, brave, courageous, heroic,
Hmm. Hmm.
give help, don't ask for help. I don't want to be the weak link of any company, so we struggle. And that's what I did. I struggled. I isolated on my off days. I used to sit at home and watch the video of her just before her surgery and things. And it's like, wow, didn't realize how a little young 22-month-old granddaughter would change your focus in life.
Absolutely. Absolutely. The little ones certainly do, whether it's your grandchild or your children. Um, very, very similar experience in my life. My daughter got um, bit by a dog. She's 15 now, so this was probably 10 years ago, and she got bit right in the face, and it just terrified me. And I was like, my mom, who's an elderly lady now, she's 88. It's really my great aunt, but they adopted us and raised us from a very early age. So that's been my mom my whole life. She used to tell me all the time, she said, you'll never understand until you have kids. You know, you can see the injury or you can see something happen here with somebody else and you're just, nah, okay. But when it's your kid, even some of the slightest stuff can make us really uneasy. So I think kids have a way to push us a little further than we'd like to go in our emotional
Right.
hemisphere, if you will.
No, absolutely. And then you can see how we can associate it when we go on a child drowning call or a vehicle accident
100%. Yep.
or a sudden infant death syndrome. I mean, these are issues that we relate to our own personal lives, and it can be a very challenging career. There's no doubt about it. I was a fire medic for many years, and
Hmm.
so it's uh, it's something that we have to watch out for.
And when I speak publicly, that's one of the things that I talk about because numerous of the speaking engagements I've done, have really been focused on this one call in 2017. I've shared it so many times on the show, but I think it was a pediatric drowning. But I think what got to me more than anything else was this kid's hair reminded me of my daughter's. The smell of the chlorine was something I smelled every year
Right.
for so many years. And, his little face reminded me of hers, and just everything. And it just tore me up. And it surprised me, because that was by far not the worst thing I'd ever seen. But that was the thing, because it had so many of those facets that reminded me of my kid. And I put myself in a very personal headspace to, kind of be in that arena with that kid, thinking this could very easily be my child. And she was about the same age at the time. So it was very difficult. But I guess I want to get, and you've mentioned a lot about the FBHA. So how do you guys actually track that data? How do you go about obtaining how many suicides has been committed, or however you would like to put that,
Completed
by our
completed.
brothers?
Right.
Completed.
Yeah.
There you go. Thank you.
Right. Yep. Early on, off our webpage, we put a confidential reporting system, and I got that from a good friend who has since passed. And so he said, yeah, go ahead and use it. And so what happens is, it's under one of the tabs. People fill it out and they hit submit, and the emails are scrubbed. So I have no idea where they come from. And so I would then contact the fire chief of that department and introduce myself and explain what I'm doing. And confidentiality, of course, I'm being a battalion chief, licensed counselor, and things. I have to have confidentiality, and to really enforce that with fire chiefs who don't even know who I am. But through the years, because I've traveled about 1.6 million miles, speaking across the U.S. and Canada, I get phone calls now. I'll get text messages. I'll have chiefs call me en route to a scene of a firefighter that's taken his life in their department and say, Jeff, what am I supposed to say? And so they know who we are. We've had 100% compliance in regard to when I call, because they'll quick Google, they'll look up, they'll see, you can Google FBHA. Our data is used by the United States Fire Administration, the NFPA, NVFC, media. Department of Labor contacted me a few weeks ago. So we
Wow.
feel very honored that they trust us. And it's like a peer
Sure.
support team. You break confidentiality, you're done, and FBHA would be done. So we walk a very, very tight line. But I'm the only one who's seen the data, and so that makes it a lot easier as well. But out of the 2,353 suicides that I have confirmed now, which that number is a lot higher than from April, I have personally spoken to about 2,300 chief officers or supervisors to hear the methods, the reasons, and any other type of data that I serve. And then we use that to create workshops. And that's what we did when I started looking at the data on the reasons why. And so that's why FBHA, with the help of some good friends, Elizabeth Fletcher and Chaps, who's a military chaplain out of Rush Memorial, we did a white paper on moral injury a few years ago. And so we always go back to the data. And still saying that, though, Kevin, we only estimate about a 60% reporting of
Right.
all the suicides. And we track firefighter, which is career volunteer, wildland, military. Like I said, I've now spoken at 13 Air Force bases and 2 Army bases. I even had the fortune of a brigadier general bringing me to the Pentagon to speak. And so then we
Wow.
track EMS, which for us is um, private ambulance service, EMS, private ambulance service, and then dispatchers. And so, unfortunately, it's been a bad year. And I looked at June for an example. There was a 1 week period. We lost 7 firefighters, 2 EMS, and 2 dispatchers in a week, reported to us. I mean, and like I said, with all the organizations out there doing great work, we're still losing our brothers and sisters. And that's the challenge that we face. And I tell these organizations, because they call me, we talk, and I always say, hey, we might know the ones that we lose, but we'll never know the ones we save. And that's why we get up every day to do what we do with our organization, is to get out there for, help out our brothers and sisters when they call, find the resources, check out the resources. I was just down in Florida on Thursday and Friday, checking out an inpatient facility for first responders. So these are the things that we need to consistently do. Will we ever get to zero? I don't believe so, because you're dealing with human beings. You're dealing with emotions. But one thing that really, if you really want to irk me, Kevin, is to make a statement that suicide is always preventable. You can't make that statement, because what that
There's no way.
does, right, what that does is put guilt then on the families and the family survivors and the friends. If it's always preventable, yet my son took his life, what did I do wrong? And they carry that guilt. And so there's a lot of things that I've learned. I've learned, never use the word trigger, because that when you're in a conversation with someone, that might bring them to a point where they found their loved one who died by firearm. And so you don't want to bring them back to that point. But I think the greatest thing that I've learned over all these years is that I've learned not to judge, because I'd never walked in our brothers and sisters' shoes and the issues that they might have been dealing with since their youth. I can't judge them. And anyone who does in regard to suicide, shame on them.
Yeah. Yeah. Agreed. So do you see a distinct difference between firefighters, EMS, and dispatchers? Or is there one group that has kind of maybe even created a culture that this is more prevalent in?
Yeah, well, like I said, we look at our data, and I actually wrote it down. We have, out of the 2,353, 1,973 of them have been firefighters, 357 EMS, and only 23 dispatchers. Are there more than that in dispatcher histories?
Sure.
Absolutely. Absolutely. Same with EMS. Now, my opinion, Jeff Dill's opinion only, not FBHA, but Jeff Dill, I think for EMS, because a lot of them are for-profit organizations, I don't believe they really want to release any information that a member of theirs has died by suicide.
I would
And
say
and I
you're
can
probably right.
understand that. I can understand that. And the other issue that I feel a lot of people might struggle with is that states now are going to try to track suicides in their states, either fire departments. And that might be a problem, because a lot of families, they don't want their loved ones to know that they died by suicide, because they don't want people to judge them. And if you're sending them off to the state capitol or the state fire marshal's office, that might create a problem as well.
Mm-hmm. Absolutely. So, what does all this data tell you about the true timeline of an operator's career? Do you see that there's a fall off after so many years? Or do you see people actually reaching retirement? Retirement's a real thing, I feel like, in the fire service, but I don't feel like retirement is a real thing, because my entire career, I worked either volunteer fire, I did paid fire for just a short time, and then transitioned into the private EMS side. And stayed private EMS the majority of my career. And retirement is just not a thing in the private sector. Like, we don't have the private sector for us was always the launching point to get to somewhere else, whether it be flight, whether it be, hospital position. For me, it was taking the business path, and kind of management path. But do you see that there's some point in that? Tell us the timeline, but then tell us if there's some point within that timeline that can be identified based on the data to say this is the danger zone. This is kind of where we need to watch people.
Well, and it's a great question, Kevin, because what our data shows us is there's no discrimination. It really doesn't matter if it's fire, if it's career, volunteer, city, suburban, rural, male, female, ages, ranks, retired, resignation, on duty injury. Doesn't matter, if you're EMS or dispatchers. There's just no discrimination in it. So we can't really pinpoint, hey, you know what? If you're age between 41 and 50, this is the percentage. Because when I break it down into our data of 17 to 30, 31 to 40, 41 to 50, they're almost even. They are absolutely almost even. And then it drops off when you start looking at 61 to 70 and then 71 to 100. It drops off in the retirement. But that's also only because it's very difficult to find retirees. They disconnect from the fire departments, they move, and people lose touch from them. And so trying to find that data is absolutely an issue for FBHA. And so out of the 2,353, and I'm giving you a rough estimate, I think about 411 are retirees. And out of those 411, 37 of them took their lives within the first week of retirement. And it's supposed to be our best time of our lives, and yet we're struggling. And so I went out and interviewed 127 recently retired fire EMS and found out a lot of things. Almost 90% of them felt anger towards their employers because they never really did anything and warned them about what retirement looks like on the behavioral health issue. Almost 33% of them said that they sat and drank for the first 3 months because they couldn't believe their career was over with. And close to 40, I think it was 45% felt that their life was over with. And it's like, wow, the average age of my survey was 54.5 years old. And it's like, can you imagine that, saying your life is over with at the age of 55? Even though you put 30 years in the fire service or EMS world or even dispatcher, to say that. And so that it becomes a very challenge. And so what I've created, of course, is saying goodbye to the emotional detachment. It's a workshop for retirees and to help them and their families. But I just recently created a behavioral health guide. It's just a small little booklet to give to retirees to say, hey, these are the things that you need to watch out for from the behavioral health aspect of retirement or resignation or on-duty injury, because that's not how they plan their career to end.
Right.
So these are the things that we need to consistently watch out for, even if you're fired. What are we doing as organizations? Are we assigning Peer Support Team members? Are we assigning chaplains to follow through and to see how they're doing, follow up with them? Because at what point did something happen in their career that got them to act the way that they did, that they got fired? So these are all the issues that, like I said, we can't judge. We should still be there for our brothers and sisters.
I don't guess I ever thought about retirement in that regard, that it's a time of like fear in the unknown and kind of going away from what you know. I don't think I ever thought about it that way, but that does put a new, I heard you say that first at the mental health conference. And one of the things that I sat there with myself and had to really think about, like, what does retirement look like? Cause I've got my 403B to set up to retire at 55. Contributing enough. And many of my peers that are my same age, I'm 38, have the same thing set up. 55, we're shooting for getting out of this place. And I sat there with myself and I'm like, but what am I going to do? Like, and I think that's a question we all have to at some point ask ourselves, what's after this? And I think it goes a lot into that identity conversation. We have a lot that we attach our entire identity to being a firefighter, paramedic, police officer, dispatcher, whatever it is, healthcare professional, you name it.
And those were the keys, Kevin. When I spoke to the retirees, the three big issues were loss of identity, loss of belonging, and a lack of purpose. And if you wake up in the morning and you have no purpose, that's a struggle. That can lead to really severe depression very quickly. And so these are the things that, we talk about in our workshop for retirement is, hey, 6 months to a year out, start planning that. What does it look like for you?
Mm-hmm.
And there's a lot of different things that we recommend in regard to retirement. One of them, of course, is if you are married to have a partner 6 months out, you need to go to marriage counseling, figure out, hey, what's retirement going to look like for you guys? And so those are issues that we all need to address.
I think one of the issues that we had finally getting together on this podcast was that I got really sick a few months ago and dang near died. But having to go through that and now being off work I'm at the 2-month period right now, being on short-term disability and being at home all the time. Now, it's been great for childcare. We haven't had to pay anybody to watch our son because he could just hang out with me all day. But really being at home all the time, it reminded me of some of the things you said, because there at the start there when I was still in the hospital, you wake up and I didn't know what my purpose was anymore. And it is a shock to the system. It really is, because you've
It
lived
really
this
is.
whole, for me, 20-year career where I've had purpose every day. And now I don't. And that's scary to think about. And it was a scary feeling to kind of walk through. And, I don't know how much of a faith driven guy you are, but I'm very faith driven.
Oh,
And I had,
so am I. I'm very. I don't do what I do without having the good Lord on my side.
I mean, and I had to lean a lot on that and to tell myself that, hey, you are still the image bearer of God. You are still created in his image. You do have a purpose. Maybe it's not managing this large pediatric organization that you've managed for the past almost 2 years. Maybe it's not being a paramedic right now, but there is a purpose for you in this life. You are not purposeless.
Yeah, and that's why I ask people, especially when I was doing counseling with first responders, is that, hey, take a look in the mirror. And it's amazing
Mm-hmm.
when you look at your eyes and you see all the good and bad that has happened in your life. And as a first responder, you were making some life-saving decisions. You were commanded in some instances, and next thing you know, that's all gone, and no one listens to you. No one really cares. Oh, you were in the fire service. Oh, that's nice.
Yeah.
How
Yeah.
about them Red Sox? And it's like, okay. Before everyone asked, hey, what kind of calls did you have? Hey, what was your worst one and things? And now it's just basically, hey, you're just one of us now, and so it becomes a big issue with retirement, and that's why I'm a firm believer in Maslow's pyramid. The top,
Yep.
pyramid there is self-actualization. Take what you know and pass it on to others. That was one of the reasons why I put in my application for this job here in Las Vegas, because I've learned so much from our brothers and
Mm-hmm.
sisters, and I wanted
Mm-hmm.
to pass it on to my brothers and sisters and our dispatchers here in Las Vegas. And we are so multi-talented as first responders. There's so many things that we
Absolutely.
can do, and we've limited ourselves to say, "Oh, I'm just a first responder." No, you cannot let the job define who you are. It is just, and I loved being a firefighter. I would do it 10 out of 10 times, but I never let it define who I was. And that's where a lot of people unfortunately get lost, because once they
Yeah.
retire, they're 58 and it's like, okay, what do I do now? And it quickly turns into, man, I got nothing to do. I got nothing to live for. Maybe I'm divorced already. So what am I going to do? Travel a little bit? I can only do so much of that. And that's where you have to really focus on finding your purpose. What do you want to do? Do you want to go work at a hospital where, volunteer time where cancer patients, especially kids, are? Maybe you want to work at animal shelters. Maybe you want to start a secondary career because you have a hobby you want to make into a business. Go back to school. And just like, if you recall, and I can, because even though it was many, many years ago, we used to have a guidance counselor in our high schools. And it
Oh,
was
yeah.
to say, hey, what do you want to do with your life? And so we have counselors out there that do that. So be, a year out before you're about to retire, call a counselor and say, hey, you know what? They'll give you some different type of testing to see what your strengths are, but chances are you know what they are already. And it's a big world out there, and people don't realize that. We live in this little tunnel of the first responder world. And unfortunately, due to the calls that we see, our emotions become negative a lot over the years. And we need to kind of refocus what our purpose is when it comes to retirement. And starting out about a year before you're about to retire is a great start.
Yeah. And I say this a lot. You mentioned it and what you just said, that many times we let cynicism and negativity sneak into our psyche, and we kind of let it live there for free. And what happens with cynicism and negativity is it is so, so contagious. I have watched it, even in my organization that I'm running or assisting in running. I have watched it get into one particular station and just erode the foundation of the culture so quickly. And I think that when we start to be more mindful of what we let in, we can control. It's funny. Angel is, Angel's our social media director and our kind of guest liaison and coordinator. She does all the things, but she's also in our marriage group my wife and I run at our church. And she told a story this week about her family is just very inherently negative, and she won't mind me telling the story. Her family is very inherently negative, so they had a big get together, and especially the women in her family, they were sitting there complaining about everything they could think of, and Angel just started going, "What a blessing!" Everything that they said. Well, what a blessing it is that you had money to fix that leak. What a blessing it was that you got to breathe today. I mean, she just went on, and it's become kind of a joke in her house. But really, that's kind of the outlook. And I know it sounds a little frou-frou, but sometimes when you take that outlook and go, what are the good things? And Jason tells it perfectly. He says, when you're sitting in the room and you start feeling that, start looking around. Hey, there's a light switch on the wall. And you think, really glad I got lights. Or hey, there's a coffee maker over there. I really do like coffee. I'm glad I can have coffee every morning. And he said you start with those simple things and it just builds and builds and builds. And as it gets there, you're like, my life's actually not that bad.
Yeah, it's not that bad. I mean, just walk outside, look at the trees, the bushes, the
Yep.
birds that are
Touch
flying, the
grass.
clouds,
Yep.
and every time I travel, when I get home, I thank you, good Lord, for getting me home safely, to my family. And it's the small things that grow within you to appreciate your life. And of course, I'm 65 now, so my term is slowly dwindling down here on Earth. And
Don't
so
say
I
that.
think I think that's just natural that we start
Yeah.
thinking about as we
Yeah.
get older. But I've been this way because I was raised by great parents that are still alive. They're 93 and my mom will be 88. And, it's just, I've always been somewhat of I always look at the bright side of a
Mm-hmm.
situation and say, hey, how can we make this better? Or let's make this better. And so if you can start practicing that, as a person to start looking at the good things in life and it's called grounding. You're putting your feet on the
Mm-hmm.
ground and you're looking around and seeing, hey, well, these are some good things around me. It is amazing how you can shift your whole life based on being a positive attitude. And unfortunately, society, when you start talking about politics and things, and people just get dragged into this depression type of attitude and anger, and it's not worth it. It really isn't. So enjoy life, enjoy the earth that's been given to you, and enjoy the job that was given to you. But understand that once that door shuts in retirement, there's another one ready to open,
Mm-hmm.
and go out and enjoy that one. And just what I asked, like I said, about a year out, find out what door that is that you want to open to walk through.
Yeah, absolutely. And when you said that, the only thing I could think of was after staying in the hospital for 15 days and getting home, the only thing that I did, I wanted to sit on the porch, and I sat out there for 4 or 5 hours, and just the smell of the air was so refreshing. And the things that God has taught me in this season is the things that I have historically taken for granted. We walk around on two legs every day. Well, when you have to learn to walk correctly again, walking becomes a huge deal. The smell of the air, watching my son, who, like I said, is 6, discover new things that I don't even notice in the world anymore. And just being able to be at home and watch that has been such a blessing. And I think it reminds me that you take a lot of the little stuff for granted and you focus a lot on the big stuff. And just being off and being home and being disconnected from a lot of what my entire life has been for 20 years. I've never been off work for 2 months. In 20 years, this is the first time I've been off work for 2 months.
It's a
And
long time.
it just opens your eyes to things that you took for granted or you don't see every day, or you just completely look over and ignore, whether it be on purpose or inadvertently. And it really has taught me a lot. But I want you to get into, and you mentioned like the passion of your brothers and sisters and sharing this. Well, what can we do? What is this internal size up that you've come up with to
Well,
let us kind of assess
that's
something?
That's a great segue because it's a term. I was responding as a battalion chief to a fire way back when, and one of the engine officer gave me a size up of what he had, and of course we do a size up to paint a picture so we know what to see arrive. And later on that day, I was doing my paperwork, and it just dawned on me: internal size up. So what that means, that was 2012 when I came up with that internal size up, and I created a workshop called Internal Size Up. What that means is that we, as first responders, need to ask ourselves two questions every day. Why am I acting this way? Why am I feeling this way? And the best thing that we can do is listen to others, because they see us better than we will ever see ourselves. And that's key. Like my wife, Karen, of 45 years, she knows my tone of voice. She knows my body language. She knows everything about me. And I've learned to listen. But there's a bigger key to that, Kevin. And that is that we have to learn to listen to our own bodies. When it says, hey, why are we acting so angry? Why are we exploding in a heartbeat? Why are we stressed out with anxiety? Maybe turned to an addiction. Maybe started isolating, maybe not communicating with our support system, our loved ones. All these type of things are your body saying, hey, something's up. We're not sleeping well. We got to learn to listen to our bodies. It's telling us, it knows us, and saying just to reach out. And everyone knows the word resiliency. For me, resiliency begins by talking to someone. And it doesn't necessarily have to be a counselor. Maybe it's a chaplain. Maybe it's just your peer support team, or maybe it's just your support system at home. But just talk. Don't bury what burdens you. And I tell this to my brothers and sisters all the time, man. Push that pride to the side, that cultural brainwashing of how we're supposed to act.
Mm-hmm.
Because, like I said, as strong as you might think, you are no match for your brain and your heart when you struggle with issues in this world. So I'm a firm believer in internal size up. I promote it everywhere I go, and I think it's very easy. And one of the key components that really makes it successful is at the end of the day, s- you as a first responder can sit down with a loved one and say, hey, what emotions did I display today? How did it affect you? And how can we work on it for the future? And then listen to their issues and to say, hey, what emotions did you display today and how it affected me? And let's talk about how we can work on that in the future. It opens up that bonds of communication that you will need when it comes to retirement. Because talking with retirees, it's almost like an empty nest syndrome. They don't really know each other. And so, we see a lot of divorce rates high in the retirement, which then leads to the moral injury issues, where PTS is trauma-based, fear-based. Moral injury is the emotional issues. And we base all of that on the number one known reason why our brothers and sisters are completing suicide is relationships, whether personal or work relationships, by far. And we don't put a lot of emphasis on that in the first responder world. You ask someone, oh, I'm a first responder, they're going to ask, hey, you must deal with PTS. Well, yeah, it's a part of the job, but no one really puts that emphasis on the emotional impact. And so PTS is trauma based, fear based. Moral injury is emotional based. And one of the key components of moral injury is betrayal. Betrayal by management, betrayal by others, or betrayal by ourselves. And when we talk about relationships, rejection. Rejection is very difficult on human beings. And we see that. We all went through our teenage years when a boyfriend, girlfriend rejected you after, you were dating for a year or so. And those things are hard to overcome, especially when you've lived with someone for 25, 30 years and they finally say, hey, I've had enough, I'm out. So these are, like I said, these are the things that we try to work with here at FBHA.
I love that. I love that. One of the things that I wanted to jump to, um, and you kind of mentioned the moral injury, so it really does make a great segue into this. I think for years, I mean, at least as long as I've been at my current company, which is the last 10 years, we've had an employee assistance program. So, and, I have had moral injury from what we typically call on this show in a cinematic way is the administrative suits, right? Which I technically, I guess, would fall into that category now. But
Right.
um, why do you think that the administrative suits and the EAP are failing our responders so miserably.
Well, I don't necessarily know if they're failing, although I look at especially the EMS world, because I consult with American Ambulance Association a lot, so I get a lot of calls from paramedics saying, "Do you have counselors for me?" And I'll ask them, "What insurance do you have?" And it is some of the worst insurance that you could get,
Yep.
or cheapest, I should
Yep.
say, cheapest insurance, and it's tough to find counselors that take this certain type of insurance, and that's not
Mm-hmm.
fair. It's not fair. They're putting themselves out there. We all know in the fire service, if you're a fire medic department, that 80% of your calls are EMS. So when you
Yep.
have, your private ambulance service and you don't pay them as well, you don't give them the insurance. It's a real. I just wonder what the rates of turnover are for those organizations. You know,
Really high. I
is
can tell
is it?
you,
Yeah.
especially here in like Mississippi, Tennessee, Arkansas,
Hmm.
being part of that private ambulance kind of network. And there's 4 pretty large companies that kind of run the gamut of the private ambulance service, right? Until you get into Memphis, and Memphis has multiple interfacility transfer, private ambulance service. But I'm talking 911 private ambulance services. And I mean, I have watched the rotating door for the last 20 years. And it just amazes me and I think that my experience is obviously where I write a lot of this show from. And watching them, it's just it is non-existent when you talk about mental health support. It is just non-existent.
Yeah. Yeah, and I can agree with you on that aspect of it. Now, like I said, being a private entity that most of those organizations are, they're good people, but they have to answer to
Sure.
someone.
Sure.
That answering means what's the bottom line? What's the bottom dollar? And
Mhm.
we see that in the fire service too. Hey, you know what? We have some budgets. Well, we can't cut people. Let's go into training. Well, let's see. What do we want to cut? Do we want to cut hose line advancement, live fire training, or behavioral health training? Well, you know what? Let's do behavioral health next year, and then it just snowballs following year. And so, and we see it in our country, Kevin. We see where behavioral health is in regard to our homeless people, right? It's
Sure.
just they don't put a
Absolutely.
lot of money and effort into it in regard to those that are unfortunate. Most of those people have some behavioral health issues that are going on, and I see it within our organization because funding donations for us almost non-existent. And because it's behavioral health, and I've had manufacturers tell me in my face, "Jeff, we love what you do, but it's suicide." And that's a negative connotation. Or,
Mhm.
one manufacturer, as I have stated before, said that there's not much of a return on investment for us to donate for you. And it's like, no, you're out there saving people's lives.
Yep.
The same people that you're selling your equipment to.
Mhm.
And so that's your investment. And so, but to a point, I can understand it in some aspect is that how do you measure what you're doing? And for us, when you're talking behavioral health, no one's going to stand up in the middle of my workshop and say, "Jeff, because I'm here today, I'm not going to go home and take my life." We just don't see that. Now, I have a lot of thank you letters and, posts from people, but we keep that private. That's between us and FBHA and the good Lord. And so we don't go around, bragging about those issues. So it's a challenge for EMS organizations, let's say, when they don't have all the money that's available to them. They have, they have ownership to whoever is invested in their company, and unfortunately, it's the employees, and that's why you see them. They go in there, they put in a year or two just to get some experience, and then they try to look for a better place that has not only better pay but better benefits, and
Sure.
that's key. And I think if organizations could really focus on that, and maybe if we just provided a little bit better benefits, and the money will try to do that as well. I think that you'd see a slowdown in a lot of those people that are leaving.
Yeah, I think you're right. I think right now, and in my viewpoint of it, especially in my part of the country, I think that um we've adopted the awareness of mental health.
Correct.
Jason really puts this really well, and I'm going to screw this up and he's going to have a stroke. But the hazmat in the fire department, and I was not part of a large fire department, so we didn't have hazmat, but the hazmat has like the operator, the awareness level, and then like just a few different levels. And he
Yeah,
says
the
we're at the very,
technician A and
yeah,
technician B and things. Yep. Mhm.
yeah. He says we're at the very lowest level of that scale. And I think that's where we are. We've adopted the awareness, but how do we go from the awareness to the aggressive attack on this mental health thing?
Well, I'm a firm believer that every organization, whether it's police, fire, dispatch, EMS, every organization should have a complete behavioral health program. And to me, just having an employee assistance program and an EAP or a peer support team, that doesn't do it. There's so much more to it. It's a 12-point system for, FBHA. We created a 12-point system. We've actually consulted with fire departments in creating their programs, including policies, training families, training chaplains and counselors in the area, starting to work within the academies and all the way up to retirement. And so those are the things that we need to focus on because behavioral health is not going away. It's here to stay. And when we see that, and suicides, they're not going away. They're going to be here, unfortunately. But if through your proactive of behavioral health programs, you could start saving a life or two, then that makes a big difference. And what kind of money can you put on that? The saving of a life. You can. And so, these are the things that if someone wants to contact me, you know what, I'll talk to them about a 12-point program for their organization.
That's perfect. And the interesting thing about that mental health conference that you spoke at and I attended, we had, so the organization I work at has always, well, I'm not going to say always, but at least for the last 5 years, we've had a uh, peer support team that checks in and does all the things, and it's rigged to our dispatch system. So particular complaints will immediately get shoved to the peer support team or pushed to the peer support team for us to do just to check in. Hey, how you guys doing? Heard you had a rough one. But I think the beauty of what we do here at A Silent War Within is that even before going to that conference, we all have multiple friends that are counselors. We are mental health backed. Like, this is not just Kevin sitting up here talking. We run every episode by somebody, right? But getting involved with Tennessee First Responders Foundation, now I'm able to put my peer support team through their training and
Right.
have them as a resource for our organization here in the Memphis area. For now, our peer support is also counselor backed. A first responder specialized counselor is backing that peer support and training our people. I think that's a big facet of it too, that we, as departments, we've got these peer support teams, but what are they being backed by? Where's the training coming from? And I think that's very important that you vet that stuff and make sure that it's, because I really do believe that peer support is a piece of the answer. I don't think it's the whole answer.
No,
But I definitely
absolutely.
think it's a
Absolutely.
piece. Yeah.
Yeah,
But
we have,
yeah,
I have vetted here in Las Vegas. We have over 40 clinicians that I've trained. And, I work very closely with the National Volunteer Fire Council. We do quarterly trainings for clinicians. It's a virtual 2-hour workshop. And, we have a national directory of clinicians, over 400 that I have trained and vetted. And it is important. You want someone who kind of understands, someone that will be there when you call and say, "Hey, do you have an opening?" And not like, "Oh yeah, I have an opening 6 weeks from now." No, I'll try to get you in at ASAP. And all those things, the resources for departments. See, can you name at least two inpatient facilities that are specific for first responders? Can you name intensive outpatient where someone just goes 3 to 4 times a week for a few hours for intensive outpatient care? And what are your chaplains? Can you give me 6 chaplains that have 6 different denominations? And that's where you have to build those resources as peer support teams. Because for me, peer support is, hey, first is your ability to listen. You have to learn how to listen. The second is the ability to have confidentiality. Without that, if someone breaks the confidentiality in your peer support team, you're done for 10 years. And then, of course, the third one is what resources can you provide for me? And, the different types of therapies out there are mind boggling, all good therapies. Why? Because we allowed clinicians in our world and they brought in different types of therapies that are working for people. And so that's what you need as a peer support team is to find those resources. For us, I think I showed you we have a QR code. And
Oh,
so
yeah.
members carry that QR code, and all they got to do is ever look at it. They can see what clinician, what their strengths are, how to get a hold of them, how to contact BHO, which is our health options, to get insurance to get their 6 free sessions. And all that needs to be laid out. And so, as a peer support team member, it's uh, it's a dedicated position. There's no doubt about it. But then you also have to learn to take care of yourself because not only are you going on calls and you have issues in your life, now you're absorbing it from your brothers and sisters.
Mm-hmm.
And as a peer support team member, you absolutely must understand the difference between empathy and being an empath.
Mm-hmm.
Empathy is you feel for that firefighter, you're trying to help them out, but once they leave, you can call your wife, say, "Hey, what do you want to do for supper?" Where an empath absorbs each one of those problems and it becomes overwhelming in their life. And I think, unfortunately, I started seeing in 2019, 2020, after peer support really started going along, picking up speed, I started seeing peer support team members that were killing themselves in our data. And it just makes me wonder if they were really prepared to understand what it takes to be on a peer support team.
Yeah, it can definitely be a lot, and it can be heavy.
Absolutely.
So we've kind of reached the end, but
Okay.
you have given us some great information. Tell us where we can find all your stuff.
You know what? Just go to our webpage at www.ff, like firefighter, B as in Bravo, HA.org. And it has we have a lot of stuff on there. And if you want to contact me, all my information's on there as well. Feel free to give me a call if you want to look at some templates that I can provide for you, some policy templates. Don't hesitate to give me a call. And unfortunately, if you know of any suicides that have occurred in your EMS or dispatch or fire world that we might not know of, there's a confidential reporting system. It takes like 15, 20 seconds to fill out, and you hit submit. And like I said, I don't know where they go, where they came from. So it's all confidential.
That's awesome. Well, I love what you've done. I love what you're going around the country and speaking about. When are you going to be speaking next?
I'm actually going up to Colorado Springs on August 5th, and then I am following that. I am in Detroit Fire Department Public Education. I'm doing 2 workshops in September. October, I will be in Kansas City. So I'll be speaking there, and then in December, I will be doing a behavioral health cruise. So
That's cool.
first responders doing a cruise. I was asked to be a speaker on the cruise. So and things pop up. I'll be.
Yeah. Yeah.
I'm actually speaking August 14th, and then but we'll be signing my new book that will be coming out at that time. Red Helmet publisher Jesse. He's the publisher of. Our primary search, saving those who save others. It's a book about FBHA as well as family stories, survivors. So it will have it's a deep impact.
Can't
So
wait
that's
to get a hold of that. Well, Jeff, thank you so much for joining us today. We're always excited to have somebody who is, really your resume speaks for itself. You've done the gamut of everything in the fire service and mental health now, and you're really making a difference. And that's what I love to see. That's who I love to bring on, somebody who's really making the needle move. And you are doing just that. So thank you for what you've given us today. Thank you for showing us a piece of your heart, a piece of yourself. I really do appreciate it.
Well, I appreciate it, Kevin. It does get done unless we have people like yourself who are willing to do the podcast and do the hard work to get us out there to talk about it. So thank you for all your efforts as well.
Well, thank you. And for those of you listening, you know where you can find us, Instagram, TikTok, Facebook, all those places. But really the hub of all that information is our website, asilentwarwithin.com. You can listen to our podcast there. You can listen to it on any of the streaming platforms that you may use. But really that website is where everything is kind of contained. We write every week. We provide peer support services that you can utilize there and get in touch with any of the members of our team. Jason does coaching with the 5 Arrows Forge that he has. You guys can do that. That's telehealth kind of visit or in person if you're in his area. But there's one of the things that I didn't expect about this podcast, Jeff, is that we have just obtained so many resources. I mean, through the last year, we've obtained just a catalog of resources, and I love that. I love that we have that. So if you guys need something, please don't hesitate to reach out. As always, please leave a comment or a review. It just lets all the streaming platforms know that we're at least decent content for people to listen to, and they'll help push us out. But as always, as we close every show, be safe, take care of your mind, and we will talk soon. Bye, everybody.
Stay safe.
The war isn't fought in the flashing lights or the chaos of the call. It's fought in the quiet after the rig is backed in and the boots are off and the noise dies down. If today's conversation hit home, don't keep it to yourself. Share the episode with a brother or sister on your shift who needs to hear they aren't fighting alone. Take 10 seconds right now, rate, review, and leave a comment on whatever platform you're listening on. Every review, every comment, and every share helps us break through the silence that we are fighting against and help those providers who are bleeding out in the dark. We read every single message and we'd love to interact with you. None of this happens in a vacuum. A massive thank you to our incredible team here at A Silent War Within. They work tirelessly to make sure this platform stays standing. And a special, non-negotiable thank you to our founding sponsor, 5 Arrows Forge. Without the belief and backing of 5 Arrows Forge, this show simply would not exist. Founded by firefighter, author, and NLP master coach Jason Minershagen, 5 Arrows Forge is bringing real, operational level mental health readiness to first responders, men, and fathers. They take mindset coaching out of the classroom and put it right where it belongs, the home front. If you are ready to break repeating cycles, shift limiting beliefs, and lead your family with conviction, go visit them right now at 5arrowsforge.com. If you're struggling and you need real vetted resources, or if you just need a safe place to land, go to our hub, asilentwarwithin.com. Everything we do, every resource we've gathered is right there waiting for you. Remember, the war in your own head stops the moment you stop fighting it alone.